Hi, this week I want to talk to you about being a good listener. Are you a good listener? It's easy to identify and recognize when somebody is not listening. They're looking at their telephone, looking out the window, they're just not engaged with you. But behavioral scientists have found that good listening is one of the most important things we can do to develop a relationship. And yes, we are developing relationships with our patients and our coworkers. And so, how do you become a better listener? The first thing you have to do is take an active approach to wanting to understand and be interested in what the other person is saying, to make them feel understood and heard. Going through the motions of nodding, like we've all been told, nod when somebody's talking to you, smile at them. Those are all things we should be doing, but you also know when those are motions. Those are not things that are really showing us somebody's listening. So a few things that you need to know is, first and foremost, a good positive body language. Your shoulders back, leaning into the person is often effective, but not being closed off, not being turned away, looking over your shoulder, which can sometimes happen when we're inputting into Epic. But to take the time to give somebody your undivided attention and demonstrate your desire to understand what they're going through. So I want to talk to you about some tips. The first one is that when you sit down with the patient, they're going to tell you why they're there, or they're going to tell you what they're feeling. And I would encourage you to remove any distractions you may have. So if you're in a patient room, put your phone away. Make it not visible, not in your hand. We do know that research shows just actively seeing somebody with a telephone in their hand, whether they're looking at it or not, people feel less heard. So put that away. Put it in a pocket. You don't need it for the next minute or two or 5 minutes, whatever time you have with that patient. And then if you're in an exam room, or even in our patient rooms, working on your computer, putting in Epic, tell me why you're here, looking over your shoulder. Don't stop. Put the computer aside for a moment. You're smart. You can remember what they're telling you, and give them a moment. And then don't interrupt them. A lot of times we are anxious to get on, but I'm going to ask you to stop, not interrupt them. If you have something to say, wait for a natural pause to interject. And then in that moment, ask them an open-ended question, something where they can dive deeper into what they're telling you, and they can experience your desire to understand what's going on with them and want to hear what they're feeling. And then after that, summarize to them what you just heard and ask for clarification. Ask, did I miss anything? This really instills in a patient that you listened to them, you heard their complaint and what was going on with them, and that you want to understand. And then, while this is a hard one, this is tricky, because when people are giving us a whole bunch of information, we're planning in our heads what we're going to say back. And this takes practice and training. I'm going to ask you to not do that, because when you're planning in your head, often you get distracted and don't hear what they're saying because you're trying to decide what you're going to say. So stop, be present for a moment. It's okay if you get distracted to say, I'm sorry, I missed that. Can you repeat that? Or I think I misunderstood something here. Would you tell me that again? That often is uncomfortable to do, but then they know that you really want to hear them and that they're being listened to. So that is a great practice. And then finally, you don't have to come right back with a response. If they've given you a whole lot of information that you need to process for a second, just say, okay, give me a second. I'm going to process this. I'm going to think about this, and then I'm going to give you an answer, or I'm going to respond to you. These are all great ways that we can be good listeners for our patients. And patients report that when they're listened to, they have a higher degree of trust for us. They positively respond to their patient experience. They say they had a much better experience. This is true with our patients. It is true in your personal life. People want to be seen. They want to be heard. And oftentimes you don't have to agree or give them the answer they want. Just the knowledge and the comfort in knowing that you listened to them and you want to help them and you want to figure it out. That is the key. So practice these things. There's a little short write-up on the 4 tips, but practice being a good listener. Be a good listener with your coworkers. Be a good listener with your patients. Be a good listener with your family. Have a great week.